everyone, my name is Alex Fish. I did the first part for our presentation on borderline personality disorder. So first, what is borderline personality disorder, or BPD? It is a pervasive pattern of instability in interpersonal relationships, self-image, and affects that's marked by impulsivity that usually begins in early adulthood in a variety of contexts. People with borderline experience a range of distressing emotions and ways of thinking that are rooted in low self-esteem, unstable sense of self, and fears of abandonment. Self-injurious behaviors and suicidality are also common with this disorder. As for the diagnostic criteria for borderline, in the DSM, borderline can be diagnosed with 5 or more of the following criteria. So the first is frantic efforts to avoid real or imagined abandonment. Also a pattern of unstable and intense interpersonal relationships that are characterized by alternating between extremes of idealization and devaluation. Then there's the identity disturbance, and that is just an unstable sense of self-image or sense of self. Impulsivity in at least 2 areas that are potentially self-damaging. Then there is recurrent suicidal behavior, gestures or threats, or self-mutilating behavior. And that is different than, the fourth one, which is impulsivity, and that can be damaging. I'll touch on that in a little bit. Then for the 6th criteria, there is affective instability due to a marked reactivity of mood, which could be intense episodic dysphoria, which is just feeling really unhappy and really just miserable overall. Irritability or anxiety that usually lasts for a few hours and rarely more than a few days. Then there's the chronic feelings of emptiness and inappropriate intense anger or difficulty controlling anger. And the last one is transient, stress-related paranoid ideation or severe dissociative symptoms. As for the signs and symptoms of borderline, I kind of touched on this with the criteria, but specifically there is the splitting behaviors, which was the idealization versus devaluation, which commonly occurs in interpersonal relationships. So idealization is like someone is all good, they are on a pedestal, they can do no wrong. And then there's devaluation, which is they are all bad and all they do is wrong. People with borderline personality disorder can also experience dissociation a lot of the times. There is stress-related paranoid thoughts. Severe cases of borderline can actually lead to a brief psychotic episode. And then the impulsive and excessive behaviors, like excessive spending, risky sex behaviors, substance use, reckless driving, or binge eating. And this goes back to the criteria that I mentioned about impulsive decisions or behaviors that could be potentially damaging to themselves. And then there's also frequent displays of temper, constant anger, or physical fighting. There's the self-mutilative acts, which are usually burning or cutting. And then there's sudden and dramatic shifts in self-image. So they could change their goals, their values, vocational aspirations, and that stems from kind of an unstable sense of self or self-image. And then also anxiety and depression overall can be signs and symptoms of borderline. As for the causes, there's not one specific marker, but some of the sources talked about the brain and how emotion regulation and decision making and judgment portions of the brain may not communicate well with one another, which suggests that there is a neurological basis for some symptoms of borderline. As for environmental factors, a lot of people who have borderline have experienced traumatic experiences, whether early in life or during childhood. And that could be such as physical abuse, sexual abuse, neglect, or separation from caregivers during childhood. And then there's genetics. So borderline is 5 times more common among first-degree biological relatives of those with the disorder than in the general population. Then as for prevalence and populations affected, there is estimated to be around 2% of the population diagnosed with borderline, but it could be up to 6%, according to the DSM. And then as for care settings, around 6% is diagnosed with borderline in primary care settings, 10% in outpatient settings, and 20% in psychiatric inpatient settings. The prevalence of borderline decreases in older age groups, which I thought was really interesting. And then approximately 75% of the borderline population are female, which is also interesting. And I'm wondering of the implications of men who are diagnosed with borderline and kind of where they fall and if they are actually taken seriously. As for treatment options for borderline, there's a lot. So there's just individual psychotherapy, just individual sessions. One of a treatment kind of intervention could be dialectical behavior therapy, which is CBT. This was actually created specifically to treat borderline. It's used for other areas and like personality disorders and substance use issues, but it was for borderline when it was created by a woman named Marsha Linehan. And then there's also cognitive behavioral therapy, which is another staple for people with borderline in therapy. Group therapy can also be beneficial, as well as medications. So mood stabilizers, antidepressants, and low-dose antipsychotic medications are all options for borderline. And then here is the video, which I will link in the Canvas thing. And that's it. Thank you.